Most drivers walk into a DOT physical without knowing what the examiner is actually checking. That uncertainty makes the whole thing feel like a test you can't study for. You can. Here's exactly what happens in that room. First, your examiner checks the basics: blood pressure, pulse, height, and weight. These give a quick read on your cardiovascular health. Blood pressure is one of the most common reasons drivers need a follow-up, so if yours runs high, get it managed before you come in. Don't show up after a long haul and a gas station energy drink. Next is vision and hearing. You need to pass a visual acuity test, with or without corrective lenses, plus peripheral vision and color recognition. For hearing, you need to make out a forced whisper from at least 5 feet away in at least one ear. Glasses and hearing aids are fine, just bring them. After that, the examiner checks neurological and musculoskeletal function. That means reflexes, range of motion, muscle strength, and balance. Driving long hours puts real demands on your body, and this part of the exam confirms you can handle them. There's also a brief mental health screening. The examiner is looking for signs of confusion, severe mood instability, or conditions that could affect your judgment on the road. This isn't a psychological deep dive. It's a check to make sure nothing's being left unmanaged. You'll be asked about your medical history and current medications. Bring a list. Conditions like diabetes, sleep apnea, and heart disease do not automatically disqualify you, but they need to be stable and documented. If you're managing something with medication or treatment, have the paperwork ready. Your examiner needs to see that it's under control, not just that it exists. There's also a urinalysis. This checks for glucose, protein, and blood in the urine, things that can flag kidney issues or uncontrolled diabetes. One thing drivers sometimes misunderstand: this is not a drug test. Substance testing is a separate process under DOT regulations. Speaking of substances, you will be asked about past or current drug and alcohol use, including prescription misuse. If there's a concern, you may need additional documentation or testing. Be straightforward. Trying to manage around it usually makes things harder, not easier. That's the full picture: vital signs, vision, hearing, reflexes, mental health screen, medical history, urinalysis, and substance use. Nothing hidden, nothing random. The DOT physical is not designed to pull you off the road. It's designed to catch problems early while you still have time to address them and keep your certification. Walk in knowing what to expect, and you're already ahead of most drivers who show up.